Hello everyone, welcome back to my channel. So today in this lecture we are going to study about the Zollinger-Ellison syndrome. So what is Zollinger-Ellison syndrome? It is a rare condition in which one or more tumors grow in pancreas or in upper part of small intestine. Okay, in this condition, a gastric producing tumor is present in the duodenum or pancreas, and a triad is present in which a gastric acid secretion will be more. If acid secretion will be more, so ulceration will be present, and if ulceration, it is considered as gastrinoma. When it cannot be eradicated or treated by PPIs or any therapy, if it is large, then it is named as Zollinger-Ellison syndrome. So, what are the clinical features in these cases? Patients having peptic ulcer disease in which a tumor is large, ulceration is large, multiple, and present on unusual size. In normal cases of PUD, it is present in duodenum or antrum, but if it present in distal duodenum, jejunum, it is considered as unusual sites. And if it is failed to respond to medical therapy and the patients are associated with having diarrhea or MEN type 1 disease. So these are the clinical features. How we can diagnose this disease? We can diagnose by gastric aspiration, in which gastric acid secretion will be more. Serum gastric level we can diagnose, in which the patients are having 10 to 1000 times raised levels of gastrin. We can do by injection of secretin. We can inject secretin, which is called as secretin study, in which gastrin level will be high in the Zollinger-Ellison patients. We can do endoscopic ultrasound. It is a treatment. It is a investigation of choice. We can localize the tumor, we can stage the tumor by endoscopic ultrasound, we can do radio label approaches, we can do PET scan. If we do breath urea test or urease, both will be negative in this kind of patients. How we can do the treatment? In the early stages, we can do surgical resection. And if it is metastasized, symptoms can be relieved by PPIs or octreotide. So stomach tumor is divided into various tumors. Like first is gastric carcinoma, second is gastric lymphoma. We will study about the GIST tumor. We will study about the carcinoid tumor. So first we'll study about the gastric carcinoma. It is the most common malignant tumor, and the location is dependent on the countries. Like if it is developed, it will be located mostly in fundus region, and if it is developing, it will be present in antrum or lesser curvature. So risk factors of this tumor include H. pylori infection, more use of nitrites, smoke-related foods like meat, fish, smoking, chronic gastritis, Mentri's disease, gastric adenoma, Barrett's esophagus, and genetically it is associated with the blood group A, family history, or like hereditary non-polyposis, and it is predominant in males. Morphology dependent on the depth of invasion, and histology. If histology, intestinal and diffuse means infiltrative, intestinal leak metaplasia is present. Depth of invasion, if it is early, it will confine to mucosa and submucosa, and if it is present in advanced stages, it will be in invasion of muscular walls, and it will spread to distant areas. Metastasis. If the metastasis comes up to the supraclavicular lymph nodes, it will be called as Virchow's node or Trousseau's signs. If it is present around the umbilical, periumbilical lymph nodes, the subcutaneous nodules will be made, and it is called as Sister Mary Joseph nodule. And if it comes up to ovary, it is known as Krukenberg tumor. Clinical features include early presentation like asymptomatic, and if it is late presentation, it will be present as weight loss, anorexia, epigastric pain, and the occult bleeding will be present in the fecal testing. The iron deficiency anemia will be present. We can diagnose by upper GI endoscopy, or if we have to do the staging, so CT will be done. Laparoscopy can be done. Treatment includes early or partial total gastrectomy. Palliative treatment can be present. Second is gastric lymphoma. Gastric lymphoma can be low grade or high grade. Low grade is called as mild, and if it is treated with antibiotics, and it is the only treatment, only tumor which is treated with antibiotics because it is associated with H. pylori, and the triple therapy is provided: clarithromycin, amoxicillin, and PPIs. In high grade, first we will treat with surgery, then chemotherapy, and then radiotherapy. Third is GIST, which arise from the interstitial cells of Kazal. metastatic tumor, and carcinoid tumor which can arise from the enterochromaffin cells.